Today we're taking a look at one of the greatest bodybuilders of all time and the health problems he suffered as a result of his training.
When you want to be the best, you ain't gonna be the best if you don't make any sacrifices.
And with 8 Mr. Olympia titles to his credit, there is no doubt that Ronnie Coleman's sacrifices were rewarded.
The new Mr. Olympia, Ronnie Coleman.
Collapsing to the ground in gratitude after his first win, you can tell just how badly he wanted this.
This is a great city. This is a great win. And I thank y'all all from the bottom of my heart.
Over the next 9 years, Ronnie gave every ounce of his being to the sport of bodybuilding before he retired in 2007. Fast forward to the year 2022, and Ronnie has difficulty walking without crutches, having undergone more than 12 surgeries on his back, neck, and hips. Ronnie, a gladiator to the core, still maintains that his success was well worth the price that he paid.
I read an interview with you where somebody asked you, do you regret anything?
Yeah, I remember when I was squatting 800.
This is the session he's referring to.
I didn't think I could do 2 reps. I knew I could get at least 1. But I went down, I got 2 because the first one was real light.
And naturally,
now that I knew I could have done 4, that's the only regret that I pretty much have.
So how did such an impressive body end up with such severe complications? Well, Ronnie's injury history starts relatively early in high school.
Well, I hurt my back in high school, actually, to be honest with you. I remember deadlifting and I hurt my back real bad.
We can only speculate as to what this injury may have been, as Ronnie never mentioned his diagnosis or treatment. However, research shows the deadlift to be a risky exercise when performed overzealously or incorrectly. A 2018 study from BMJ's Open Sport and Exercise Medicine explains that the deadlift exercise seems to cause the majority of powerlifting injuries, listing fractures, muscle ruptures, various low back injuries including spondylolysis and damage to vertebral ligaments, among the numerous possibilities. Ronnie, like many athletes, holds the belief that pain is an inevitable part of his process, and he continued to train through it for most of his career.
For the most part, my back would always hurt when I worked out, but it was hurt while I was working out. Once I stopped working out, the pain went away.
For the record, you shouldn't experience pain when working out. Difficulty, strain, tension, sure. But when you feel acute pain, it is likely a sign that something is wrong. This is different if you're recovering from surgery or an injury. But in those cases, your physician will help you determine the safe thresholds for pain and discomfort. Unfortunately, Ronnie didn't seem to address his injury in any meaningful way until he was injured again while playing college football, at which point the pain was worse.
And then I heard it real bad playing football. I mean, I heard it so bad playing football that I had to go to chiropractor.
I am resolved to keep my opinions on chiropractic treatment out of this video. But it is ironic that the man with one of the most injury-riddled spines I have ever seen depended heavily on chiropractic care throughout his career.
He had to work on me for like every single day. I was going every day, months at a time.
If you are doing something every day for months on end and you do not see progress, something is wrong. Possibly with the patient, possibly with the treatment.
But going to the chiropractor, was able to help me keep it in check and stabilize everything.
Ronnie says that the chiropractic treatment was for maintenance purpose to keep his pain in check. And while it may have been successful in doing so, it was unsuccessful at treating the root cause of his problem. Granted, with as many surgeries and revision surgery as he now had, those failed him as well. Quick side note. I am aware that my view on chiropractic medicine ruffles some feathers, and I am planning a comparative analysis between it and surgical intervention, as many of my critics have mentioned that surgery is inherently dangerous, a fact of which I am also aware. I will address these criticisms head on in a dedicated video. For now, I am glad to hear that the chiropractic treatment helped Ronnie to feel better.
Man, he put me on all these machines and had me doing all this massage therapy, and I started feeling a whole lot better,
And I am hopeful that the machines to which he is referring were active exercise machines incorporated in his recovery. Unfortunately, when it comes to Ronnie, I don't think any type of intervention would have had the desired effect due to his unwillingness to rest and recover adequately. In fact, when Ronnie faced his first herniated disc, the surgeon presented him with two options.
You can get surgery on this herniated disc, but if you don't want to, you're gonna have to do some kind of rehabilitation. So I'm like, okay, well, I'm going to chiropractor.
And thankfully, his chiropractor also recognized the severity of the situation and requested that he stop squatting.
They told me to quit doing squats. I'm like, okay, I will. That's the first thing I do when I get to the gym, do squats.
Thus, my research has led me to believe that prolonged overtraining and injury mismanagement are the root of Ronnie's dysfunction.
How much pain do you feel every day on a scale of 1 to 10?
9, 10, pretty heavy.
So if by chance you clicked this video expecting a dissertation on the risks involved in prolonged steroid use, this is not that. I covered that topic in a previous video. I'll leave a link down below so you can queue it up for later. And even though Ronnie's physique was enhanced by an extensive PED stack, his propensity for lifting super heavy weight and ignoring pain seemed the likely culprits in his spine tingling history. As a medical professional, I would like to be able to tell you that he could have achieved what he did with a more conservative, health-conscious approach. But he is one of only 2 bodybuilders with 8 Mr. Olympia wins, and his equal, Lee Haney, accumulated his wins many years earlier when everyone's physique was more conservative.
Ronnie took weight training, strength, to a whole nother level.
Like any sport, bodybuilding's success at a given time in history is determined in the broader context of the sport. Whoever is crowned king must only be better than the competitors of their time.
Ronnie came along in an era which you had Dorian Yates, which was larger than myself. Dorian was a mass monster,
And Ronnie would take the blueprint laid by Dorian even further, breaking away from those who came before. In a sense, he is a pioneer. And exploring new territory isn't always pretty, as the explorer stumbles to find their footing on new ground.
Because the body works in the way of demand and supply. If you're asking your body to produce a larger muscle, you have to physically give it a greater demand.
Basically, yes. But we need to dive deeper to understand how Ronnie's training may have affected him. Muscles change to respond to the demand that is placed upon them. Weight training creates micro tears in your muscle fibers, which the body repairs to a more robust baseline in an attempt to prevent more damage in the future. How this repair manifests, whether as more strength, endurance, muscle size, among other metrics, depends on the desired outcome of the athlete and will change the details of the training that is undertaken. By and large, a bodybuilder's main concern is hypertrophy, which is an increase and growth of muscle cells and overall muscular size. Research agrees with Lee and shows muscle hypertrophy follows a dose-response relationship, with increasingly greater gains achieved with higher training volumes. Taken at face value, you may conclude that more weight or more time in the gym equals more muscle.
We've all heard these sort of tropes of outwork your opponent. What if he's training too much? Should we just double time it and just really die?
Interns, let me introduce you to Dr. Mike Israetel, who holds a PhD in sports physiology, training, and nutrition. On the right. The clips I want to share with you are from a great episode of fellow content creator Jeff Nippard's podcast right here on YouTube. The information shared provides a great backdrop for understanding why Ronnie was compelled to train so hard. The study above showed greater muscle gain as a result of higher training volume. But what exactly is volume?
Volume is actually pretty easy to define. It's the amount of physical work you do, measured by essentially force times distance.
Can you say a little bit more about that, Doc?
Measurement of that in the gym, weight on the bar, distance, which is usually the obviate, and then the number of total repetitions that you do in training.
Obviously, Ronnie was trying to maximize training volume. More weight, more reps, full range of motion to yield greater hypertrophic gains. In his quest to do so, he found himself flirting constantly with what Dr. Israetel refers to as maximum recoverable volume, or MRV.
There is a maximum amount of volume that your athletes can recover from. You can no longer match sets and reps at the predicted intensity that you're supposed to.
Once laid out, this concept is very intuitive.
Above maximum recoverable volume, it doesn't pay to train any more than that.
The good doctor contrasts this against minimum effective volume, which does as it sounds. Identifies the minimum effective volume an athlete requires to make gains.
So what you're left with is this kind of delineation, this band, this range where all productive training lives. And that's between MEV, minimum effective volume, and MRV, maximum recoverable volume.
If that range of optimal training is space travel, Ronnie is the first person to take a step on the moon. He found a new limit, a new frontier, and those who came after him can approach that limit with more tact and safety with his example as a guide. I mean, it isn't far-fetched to imagine that the first person to discover fire walking away from the ordeal with a few burns. Especially important in Ronnie's case as an athlete suffering from chronic back injuries is the concept of fatigue. Doc, before we let you go, can you speak to how fatigue and volume interact?
One of the things we're really looking for volume is the amount of fatigue that it causes, because we want to see how much volume we can stuff into a program.
In the podcast, Israel highlights several factors that cause fatigue more quickly. Heavier weights.
Because each rep is so much harder that it's way more than the amount of force that's added, way more than the amount of weight to the bar. The fatigue goes up exponentially.
And how close a set comes to failure.
The fatigue accumulation, the closer you get to failure, is actually exponential.
So, although there are studies that show an increase in the magnitude of hypertrophic response as an athlete approaches failure, training like your life depends on it may leave you too fatigued to perform at an optimal level in your next workout. Or in Ronnie's case, too fatigued to recover properly from a recurring back injury. When I hear him speak, I honestly don't know that any of his injuries would have had the opportunity to fully recover, causing dysfunction to accumulate in his body over time. And obviously, Ronnie is a man who takes pride in his heavy lift numbers, maybe to his own detriment. Here he issues a challenge to other bodybuilders after his legendary 800-pound squat.
800 for 2 reps. 5.5 weeks out. It's a challenge. Anybody.
Now, there is a whole lot more to be said about training volume and hypertrophy, and I encourage you to check out more of Mike Israel and Jeff Nippard's stuff later on. As for Ronnie, well...
Ronnie took it to a whole nother level. A level that was somewhat dangerous, unheard of.
Introduces bodybuilding fans all over the world to a new level of intensity.
Would I have done it? I did what I needed to do during my era to create a physique, let's say, that was representative of my era.
And Ronnie did the same. Now, let's talk about his specific injuries. Thus far, we know Ronnie's injury history began in high school when something happened to his back while deadlifting. This went untreated. During his time as a university football player, he suffered injuries to his back and subsequently went to the chiropractor for treatment. We didn't know exactly what was wrong, as he never had it diagnosed efficiently. We do know that low back injuries are common in collegiate football, and a 2019 study in the Orthopedic Journal of Sports Medicine concluded that disc herniation, contusion, bruises, and sacroiliitis, inflammation of one or both of your sacroiliac joints where the hip bone connects to the sacrum, are among the most common. Another study from 2021 showed strains and sprains to be the most common neck injuries suffered by American football players. With sufficient rest and a proper rehabilitation procedure, all of these injuries can be treated non-operatively. But I can't be sure that Ronnie was properly allocating time and resources to recovery.
Woo! Time to bleed.
Without proper rest and rehabilitation, these injuries are likely to persist and even become worse over time.
Woo!
It could be that the terrible herniated disc Ronnie suffered in 1996 occurred due to the cumulative effects of previous unresolved injuries. The aforementioned study showed that at least 15% of low back injuries suffered by collegiate athletes were recurring in nature.
The worst injury ever, I had taken off for the after an Olympia a couple weeks, and I went back to squatting. I can remember it like it was yesterday. I was squatting 600, and I always did like 15 reps, 12, 15 reps, somewhere in there.
At this point, Ronnie is working as a police officer in Arlington, Texas, and training for the Mr. Olympia competition. For context, this is prior to his first win. He's back under the bar after a few weeks rest and attempts to squat the same amount that he was prior to his time away.
And this day I was coming up on rep number 8. And I heard a loud pop. And I'm like, what the hell was that?
That, Ronnie, was your disc herniating. Let's break it down. Intervertebral discs are like dense rubbery cushions that sit between adjacent vertebrae of your spine, part ligament, part shock absorber. These are complex structures that consist of a thick outer ring of fibrous cartilage, the annulus fibrosus, surrounding a more gelatinous core known as the nucleus pulposa. A herniated disc occurs when the soft inner core of the intervertebral disc pushes through the tough circular exterior. Sometimes a herniated disc will occur due to the degeneration of the disc material over time. But it may also occur, as in Ronnie's case, much more dramatically due to a single excessive strain injury.
I'm like, well, what was that loud pop? As soon as I said, what was that loud pop, I felt this pain go down my left leg, all the way down to my foot.
Exactly. When this injury occurs, the patient may hear a loud pop, followed by severe pain running down the leg. And when something like this occurs, you should seek medical attention. Unfortunately, that is not what Ronnie did.
I'm like, well, I'm done with squatting. And I went and did leg press, hack squats or whatever. I did some hamstrings.
Do not finish your workout. Do not ignore the pain. In the case of a herniated disc, it is likely that the protruding tissue is either compressing the spinal nerve or causing painful inflammation of the nerve root. At the very least, it will require some rest. Over time, the inflammation can subside alongside the patient's pain. But once the disc's exterior is ruptured, it is unlikely to heal on its own. When Ronnie continuously says things like this,
now my back always hurt me when I was working out, but this day, I put my uniform on, I'm headed to work, and I'm like, wait a minute, my back is still hurting.
I begin to consider the possibility that he suffered a previous, less severe herniation and managed to endure the pain for many years. Injuries of this type, if left unrepaired, are more likely to flare up in the future. Might I remind you, there is already a hole in the outer ring of your disc, and a sudden stressor may cause more disc material to herniate out and possibly create an even larger hole. Whether this was the result of an unresolved prior injury or a new injury altogether, it was severe enough to force Ronnie, whose pain tolerance is obviously very high, to visit the emergency room. He later received an MRI which revealed the herniated disc.
So when you herniated that disc, what did you do to treat it?
Nothing. I'm with the chiropractor.
Chiropractor, yeah.
Oh, good. In this episode of the Joe Rogan Experience, Ronnie recounts his entire injury history, and it truly is startling how much pain this man has endured.
So the surgery they wanted to do was probably trim the disc down because it was pushing against the nerve?
Yeah, laminectomy, whatever they call it.
Yeah.
The goal of a laminectomy is to create an opening in the roof over the spinal canal to relieve pressure on the spinal cord or nerves. It is sometimes included in a larger, more comprehensive decompression procedure. It involves the removal of a portion of the lamina bone, which are arched parts of the vertebrae that cover the back of the spinal canal and stick out from the back of the vertebrae. Ronnie may also have been referring to a laminotomy, wherein the surgeon makes an opening in the lamina, which also relieves pressure on the nerve roots. When a surgeon performs a laminectomy to treat a herniated disc, they will also perform a discectomy, removing the portion of the disc that is causing the pressure on the nerve root. If the damage is severe, the entire disc may be removed and replaced with an artificial disc made from plastic and metal. At the time, Ronnie chose not to undergo surgery, instead managing his symptoms with a short rest and chiropractic care.
So I stayed at home for a couple weeks, sat on the couch and didn't do anything. And 2 weeks later, I went back to the gym. First exercise was squats.
This is the exact opposite of what I want to hear. Sitting for prolonged periods of time is associated with neck and back pain and can add pressure to the back muscles and spinal discs, especially if the posture is compromised. Ronnie's 2 weeks on the couch is of particular concern as the structural integrity of his back is already compromised by a slipped disc. And during his time off, the supporting musculature of the spine will start to weaken. So by the time he returns to the gym, although the inflammation and associated pain have subsided, both his muscular support system and the spinal integrity are compromised to some degree. This is exacerbated by the fact that he is a massive human whose basic movement patterns require more support because he just weighs so much. Now, in most cases, the pain from a herniated disc will improve within a couple of days and completely resolve in 4 to 6 weeks. In severe cases, this process can take up to 6 months. But this is not an indicator that you should jump back into training with as heavy a weight as you can tolerate.
2 weeks after you herniated your disc, you're doing squats again?
Yeah.
With how much weight?
I only did 300.
Oh, only 300.
Yeah.
This type of injury management is absolutely reckless. After non-surgical treatment of a lumbar disc herniation, athletes are generally expected to return to activity in 3 to 6 months. Only after ample physical therapy directed at core strengthening, sport-specific training, and lumbar stretching. I hope Ronnie's chiropractor instructed him in some of these treatments, because he would spend another 10 years pushing his body to the limit before he would return to the hospital.
How long before you got your first surgery?
10 years later.
10 years. Intolerable pain. Like,
I couldn't walk like 25 feet.
Before his first surgery in 2007, he established himself in the pantheon of bodybuilding royalty and retired the same year. Once the floodgates were open, Ronnie's health problems continued to arise. He'd get surgery and feel okay for a while, but unbearable pain was always right around the corner. Listen as he recounts the surgeries he's undergone.
The first one was back, second one was back, third one was neck, and then back, and hip, back, hip.
Buckle up, interns. We've got a fair amount of ground to cover. Firstly, if Ronnie had undergone surgery in 1996, there is a chance that the initial laminectomy and discectomy would have been sufficient to address the symptoms associated with a compressed spinal nerve, like pain, tingling, and any loss of function that he may have experienced. However, surgery cannot resolve the loss of spinal integrity that he suffered. Without it, the disc structure is weakened by the hernia and inflammation and likely to continue deteriorating as he continues to load his spine with heavier and heavier weight. With surgery, the disc has lost some of its overall mass and size, limiting its function and causing it to deteriorate faster than the other spinal discs as he continues to live. In both cases, we're looking at a weak link in the spinal column.
And as soon as they did that surgery, that pain went away. And I was all right, you know. But that was my first back surgery.
So, even though Ronnie underwent laminectomy surgery successfully in 2007, and it alleviated the pain he was feeling, his problem would continue.
About a year or so later, I started having problems again.
Same area?
Same area. So
Were you
it's like,
squatting heavy still?
Yeah.
Ronnie is revealing himself to be his own worst enemy. Sure, after a laminectomy, patients can expect to recover relatively quickly, usually within 1 to 2 months. However, heavy weightlifting should be approached with caution, and patients must be made aware that the surgery will not bring the spine back to its complete normal functioning and flexibility. The most striking part of this is that at this point, he is retired. And though he did deload considerably, the 400 to 500 pound squats he mentions later are not conservative by any means. He would have to go back under the knife.
Like 2008, 2009, somewhere in there. They kind of like did a refresher like that. I think they did trim a little bit more off it though.
So a revision laminectomy is the same procedure as a standard laminectomy performed a second time, and a likely indication that during the first surgery, only part of the lamina was removed. A surgeon will perform a discectomy if more of the disc has herniated out. From here, complications would continue to arise, and he would require several other operations of this type to deal with more herniated discs.
It's like you stack a bunch of cans on top of each other and you snap one out. After a while, the other one's gonna start falling.
Ronnie is right that one herniated disc has an effect on the rest of the spine, but his analogy is a little misleading. The flexible intervertebral discs sit between vertebrae segments, allowing the spine to articulate freely and acting as shock absorbers. If a disc deteriorates, the actual vertebrae begin to grind against each other, becoming far more susceptible to degeneration, displacement, and causing irritation to the surrounding ligaments, muscle, and soft tissue. More like stones stacked on top of each other than soda cans. The vertebrae adjacent to the ones with a compromised disc are also put under more strain as this process occurs. And then the chain reaction continues up and down the spine.
And that's kind of what happened. You know, the other discs started just herniating on their own. Of course, I was working out too.
Yeah.
And Ronnie would undergo several more surgeries to address his injuries. As the discs continue to deteriorate and multiple vertebral segments suffer, our only remaining option may be spinal fusion.
What happened was they put in 4 screws because the discs were, you know, shifting forward and pushing up against my nerves.
Here, Ronnie recounts the story of his first fusion, but again, his explanation is not quite correct. It's unlikely that the disc was slipping forward at this point, as it almost always herniates to the rear. Also by this point, the disc or discs in question had likely suffered severe degeneration, causing vertebrae on vertebrae irritation. The surgery would also use rods and screws to fuse the adjacent vertebrae into one unmoving segment, allowing no movement and reducing irritation in the aforementioned structures and the bones themselves. And yes, bones feel. The periosteum that surrounds the bones is a membrane of blood vessels and nerves that wraps most bones, and it doesn't like to be irritated.
Anyway, those screws ended up breaking. And in the process of breaking, they broke bones in my back. The pain got so bad where I couldn't even walk.
This is an incredibly painful experience, and my heart goes out to Ronnie for all the pain that he has suffered. Now, interns, any ideas why a fused spinal segment might fail so dramatically?
Which one of you did it?
During spinal fusion, the surgeon will roughen the edges of the bones involved to expose reactive bone, which then combined with bone graft will actually cause the separate vertebrae to heal into one solid segment of bone. The surgical hardware is screwed in place to help facilitate this process and reinforce the connection. This type of fixation is most susceptible to failure while the bones are still healing during the first 3 months. After this point, patients will begin to incorporate more exercises and physical activity under the guidance of a physiotherapist as they begin to strengthen the supporting muscles. It may take 6 months to a year for your back to fully recover, though an athlete may never regain pre-injury levels. More physically demanding movements such as lifting weights or sports should be incorporated slowly and methodically, and contact sports are generally discouraged. To be honest, lifting at Ronnie's intensity might even be closer to contact sports than regular weightlifting. There are other reasons that a spinal fusion may fail. Perhaps Ronnie has some condition that resulted in poor healing potential. Perhaps the surgeon made an error. My guess is that Ronnie returned to lifting too heavy too quickly. And at this point, his spine is really in poor condition.
How many discs have you had operated on?
All of them.
All of them, every single disc?
Every single one.
The cervical, thoracic, and lumbar spine have a total of 24 vertebrae altogether. We know that he's had a total of 10 surgeries on his back and neck. So a little simple math reveals that some of his later surgeries were much more extensive fusion procedures involving multiple vertebrae at once.
So the whole spine is fused?
Yeah.
Wow.
Neck and back.
How much mobility do you have?
Bend over and tie my shoe and...
This conjures the image of a man whose spine is one solid piece, which may be a little misleading. Joe even asks him.
It's one solid piece.
Yeah. Mm-hmm.
So there's no like articulation of your discs and your...
Complete spinal fusion is usually reserved for patients with extreme scoliosis and looks something like this. But the available x-ray that Ronnie shared via his Instagram shows something different. Notice that the surgical hardware does indeed end. This is a PLIF, or posterior lumbar interbody fusion, shown from the back and side angles. Between the vertebrae in the image on the right, you can see the bone graft that has been inserted between the bones where the intervertebral disc would have been. Obviously, Ronnie's was damaged beyond repair and the surgeon chose to replace it entirely. The screws penetrate the vertebrae adjacent to the compromised disc, clamping both vertebrae down onto the bone graft and creating stability. Needless to say, this would limit Ronnie's mobility severely.
You know, I used to be able to just bend over and do all these stretches, these crazy stretches. Well, I can't do all that no more.
He could have a comprehensive fusion of the cervical spine, but that would not be fused to the next adjacent group. Furthermore, in all but the most extreme cases, usually those involving extreme trauma, we wouldn't fuse the thoracic spine. It is connected to the rib cage and already fairly robust. Below that, the lumbar spine, where many of Ronnie's injuries have occurred, could totally be fused together. This fusion may extend down into the sacrum. In all likelihood, Ronnie's spine has been fused into several segments. And the story doesn't even end there.
What did you get done to your hips? You get your hips replaced?
Yeah, both of them. What was that? What year was that? 14?
Note that Ronnie's hips were replaced in 2014 after a ton of work had been done on his lumbar spine. Normally, your lumbar spine can accommodate a certain range of motion. When that range of motion is compromised, more of the movement that occurs must be accommodated by the hips and the pelvis. Add to this the fact that because Ronnie is so debilitated, his pelvis probably isn't subjected to a lot of force day to day, and as a result, the bone will become more osteopenic and soften over time. But he's still to this day working out and trying to push his body.
After all this, you still love working out. I mean,
yes.
You can really tell. I mean, you enjoy it.
Still a hobby.
This combination of softening bone due to general immobility, added load on his hips when active, and propensity to heavy lifting would subject the hips to higher levels of wear and tear.
And how are those now?
I just had hip surgery in January, and I had to replace both of them.
And Obviously, that issue doesn't go away just because the hips have been replaced. Still subjected to the same stressors as his natural hips, the titanium hip replacements would push against the native socket or acetabulum and create wear at the bone implant interface until something fails.
You know, titanium, and they kind of hard on the body.
Oh, yeah.
And because of that, you know, and me working out and all this kind of stuff. And
in this case, the titanium head of the hip plant caused failure of the acetabular component. Unfortunately, every time Ronnie has another operation, his healing capacity at repeat surgical sites will be reduced. I really don't even know what to say. The same drive that allowed him to dominate the world of professional bodybuilding is still, many years after retirement, wreaking havoc on his body.
You know, when you're doing something that you truly love, enjoy, and doing what you look forward to doing all the time.
So really,
regardless of how you feel, you know.
At least it seems Ronnie has made peace with his choices, past and present.
Yo. Yeah, buddy. Lightweight.
And with a growing supplement business and many prestigious awards to his credit, he is doing all he can to continue thriving. And if you want to learn about general fitness training in a sustainable manner, remember to check out my free online gym, Human 2.0 Fitness, right here on YouTube, where we help you prevent injury and move better. And as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.